And beyond the pink ribbons and hashtags, there are real stories, silent battles, and brave women. And yes, men too. Yes, men, men do survive that as well.
That big wait, Saturday we're having the screening here, and so many of us were like, "Oh, come get your breast screened," and we're like, "Huh?" I'm like, yes, men do get cancer too, so
Yes.
it's good for men to also check. It's not just women.
Men do get breast cancer as well. So tonight we want to talk all about it, from awareness and early detection to self-love, body confidence, and how we can better care for the very things that, make us human. Our breasts, the tatas. I don't know about y'all, but I love my breasts so much. I know Delphina does. Those watermelons. And of course, the special edition of Room Service is proudly brought to you by Pleasure Avenue, always reminding you that pleasure, confidence, and health all start with knowing your body. Yes.
Yeah.
And so, right quick, before we get right into it, we are going to go for a really quick music break. And when we get back, we're going to go right into it. Tonight we have with us Dr. Josephine, yes, to enlighten us more about breast cancer. And my men, I'm going to need y'all to stay tuned because men do get breast cancer as well. We do have some breast cancer survivors who are men as well. So I'm going to need y'all to stay tuned. Just stay with me as usual for 2 hours. Trust me, you won't even know that time is gone, but I'll be right back. Don't go nowhere. Are talking all things breast cancer and all things babies, because you gotta let the babies be free. Yes. And as usual, I'm your host Pearl Tabo, here with my co-host Delphina, and tonight we have with us Dr. Josephine. And as you all know, well, if you don't know, now you know that October is Breast Cancer Awareness Month, and beyond the pink ribbons and hashtags, there are real stories, silent battles, and brave women, men too, living through it. And tonight we want to talk all about it, from the awareness to early detection of to self-love, body confidence, and how we can better care for the very things that make us human, our boobs. That's the honest truth. And tonight joining us is someone who works with, who is in that field basically, and whose work and wisdom continues to change lives, and that's Dr. Josephine, who is a medical doctor and an advocate for women's health and public health as well. Yes, doctor, you're welcome once again to Room Service.
Thank you, Bill.
Yes,
Thank
it's
you.
always a pleasure having you.
A pleasure.
Yes. So, Doc, tonight let's start with the basics. What exactly is breast cancer? How does it form, and who's most at risk for breast cancer?
Okay. So when we say breast cancer, it's just abnormal cells that are formed in the breast tissues. That's breast cancer.
Right.
And so for general knowledge, when you hear anything cancer anywhere, it means that abnormal cells are formed in that particular place. And this time around is the breast.
Right. Okay. Abnormal cells are formed in the breasts. Okay, so that means, does it mean that if you've had someone who's had breast cancer in your family line, like through genetics, are you, at risk of getting it?
Yes.
At a
So
point in time?
right, very good question. So with cancers, we don't have a specific cause that you can lay your hands on that this is a specific cause. However, there are risk factors. Some of the risk factors is what you've just spoken about. That is the genetics. Yes, it predisposes you. For example, I'm sure you've heard of Angelina Jolie.
Yes.
Yes.
She cut off her boobs.
Yes.
Yeah.
Yes. Yes, because there's something we call genetic testing. When you do it and you have that gene, BRCA1, BRCA2, it predisposes you. Angelina did it. She had the genetic predisposition for the BRCA1, BRCA2, and so she had to go and do a double mastectomy and then get the ovaries out as well.
Oh my
oophorectomy.
Jesus, that's crazy.
Yeah.
Okay, so it's
Wait.
not
For the breast cancer, you get the ovaries out as well?
Yeah, I think the ovaries triggers the cancer,
Estrogen.
right?
Estrogen.
Yeah.
Okay.
So it's not just about cutting off the breast, but the ovaries as well. So your reproductive system is actually a factor,
Crazy.
right?
Breast
Right.
cancer proliferation depends on estrogen exposure.
Mhm.
That is why, as we go ahead, we unravel some of the risk factors. For example, there's something we call early menarche. That is having your period before age 12.
Right.
Okay, so scientists have done a research that says that the more or the earlier you are exposed to estrogen, the higher your risk.
Right.
So the late you are exposed to estrogen, the lower your risk.
Oh.
That is why early menarche or having your period before
Mm-hmm.
the
Recommended age.
recommended age or
Yeah.
mean or median age
Mhm.
for worldwide population is a risk factor.
Yeah.
And then also late menopause. Some people are excited. Sometimes in their 50s they are still menstruating and they are happy. It's not a good thing because still then you are exposed to what
Breast
estrogen.
cancer.
Yeah. So it's estrogen dependent.
Estrogen,
It's
right.
dependent on the hormone estrogen.
Mm.
That is why we discourage the use of contraceptive pills. Some people, right after having sex, they think that they just need to just jump into over the counter and grab some contraceptives.
Mhm.
These contraceptives have got what we call exogenous estrogen, external estrogen that you are ingesting into your system, and that can cause havoc.
So, if I understand you correctly, the ladies that take contraceptives, like the emergency pill, right, as though it's paracetamol, you're you're exposing yourself to that because it has estrogen in it, and the more estrogen you put into your body, you're more susceptible to getting that, right?
Yes.
As time goes on. Interesting. But don't you think also birth control as well does that? Because the birth control, they have the hormonal ones that also has estrogen in it, right?
No, we have what we call the IUD, the intrauterine device.
Yes.
Okay. That doesn't have the estrogen component in it.
Yeah, that one doesn't. But the one that does, the hormones, the hormonal, like the hormonal pills, and I think the IUD has the one that has hormones with it. Yeah. Is that one also a
No,
risk?
so what IUD does is it protects the uterine area and prevents the sperms from traveling to the fallopian tube for the baby to be formed.
Right.
That's what it does.
Interesting. But how about men though? How are men open to getting breast cancer because they don't have a female reproductive system?
So for men, statistics says that 99% women risk having breast cancer and 1% risk having breast cancer.
Right.
Now, for men also, they also produce the hormone estrogen, but in lesser quantity compared to their female counterparts. That is how come we see that. So then you can now draw the correlation between estrogen and breast cancer now. You
Yeah.
understand?
Yeah.
It's dependent on the hormone estrogen. And so for men, in as much as they think that they don't have the breast for you to hold, the chest area is there. The cancer can sit in there, okay, without you knowing until
Right.
when. And the manifestations are the same as we will unravel as we go ahead in this presentation.
Quick one, dog. So you said with the men, because they have the chest area, the cancer can sit in there. How long until they realize this is what's happening to me?
Okay, so it all starts with the lump. It starts with the lump, and then the other symptoms that you see: the skin colorization, there's the peeling that looks like that's of an orange, then bloody discharge. Okay.
From the nipple.
Yes, from the nipple, and then sometimes you see some lumps in your armpit area because of the lymph nodes. There's something we call lymph nodes. They drain into the breast area, and mostly because they drain into the breast area. A number of times you do not get people having the lump in the breast, but it starts in the armpit area because of the lymph node drainage.
see.
Yeah.
I see. Okay. So sometimes it can start from your armpit area and then progress down to the breast. So when you're doing the exam, I think that's why they go all the way into your armpits and then massage all the way coming down. Interesting. So, but I think there isn't much awareness with men though, because men feel like it's only women who are open to getting the whole breast cancer, and they don't actually take it serious. Because last Delphina was just saying that last week Saturday we had the area codes jam, and before
we had a breast screening exercise. Some of the men passing by, you tell them, "Oh, we're having a breast screening exercise. Come get your." They're like, but I'm a man. You're like, yeah, men do get breast cancer too. So it's good you get checked early. I mean, just know you're safe.
So 1%.
1% of men.
Yes, but you can never say never. So
Interesting. So then, Doc, how important are self breast exams and then regular screenings?
okay. So you see, like I always say, I'm a very preventative medicine person because I always say that you don't wait for the condition to happen. And mind you, breast cancer can happen to anybody, irrespective of whatever background and all that. It can happen to anybody. That's why the sensitization is ongoing, that from time to time you need to do the breast self-examination. And for females, it is ideal to do this 3 days after your cycle, after your period, because you see, during your ovulation and then during your period, your breast gets tender, you see, and you will not be able to distinguish any abnormality from you having your cycle.
Yeah.
And sometimes some people have what we call cyclical mastalgia and non-cyclical mastalgia. That is breast pain that is associated with the cycle. And some that is not associated to the cycle. Those ones, it's a myth. Some people think that once you experience that, then it means that you're going to get breast cancer. No. It's a serious myth that has been demystified as time went on from the beginning of the month. Yeah.
Interesting. I see. So that means every month you have to be checking your boobs as a woman.
Yes.
3 days after your period.
Yeah.
Okay, I see.
And then it should be done under water with soap because it makes the area very moist and very easy to run your hands over and also feel if something is happening.
Okay, so you can even do it standing.
Yes. It's just a matter of looking into a mirror and then just looking at the symmetry, the size, the shape. You see if the nipple is inverted or retracted, if there are skin changes on the skin. You see, you are looking at all that. Then you can now feel.
I see.
It's always better when you know your body. The doctor, yes, can examine and feel, but once you know your body, you'll be able to identify it earlier.
Yeah.
Because you saw that this time around they were preaching catching it early, treating it right, and surviving it. Yes, I have seen people that have survived it.
Yeah.
Because it was caught early.
Yes. That's true. So, but how about men then? Because men don't have periods. So how often do they have to check?
They can do it every month, but it can be routine. Just like postmenopausal women who are not having their period anymore. So they can just choose a routine. Maybe let's say on the 6th of every month.
Yeah.
They just do it.
Check your breast.
So if there are any disparity between the past month and the current month, they should be able to tell.
I see. But I just remembered then. So then breast cancer and cervical cancer, do they have any linkage?
No.
Are they related in any way?
No. Cervical cancer is caused by the human papilloma virus we spoke about the other time. Yes, the 16 and 18, which is very notorious. But breast cancer has multiple risk factors. Multiple, like many other cancers. Alcohol smoking cuts across for breast cancer as well. So we say you stop smoking but reduce alcohol, because we know when we say stop alcohol, it's impossible. So reduce alcohol but stop smoking, because these contain some carcinogens that can help you get the breast
So
cancer.
is it that for every woman or every individual, just reduce your smoking if you do smoke, and stop the smoking if you do smoke, and then reduce the drinking if you do drink? Interesting.
Yeah.
My people. This is interesting. Oh, I see. Okay. So with you mentioned is it BRCA1 and
BRCA1,
BRCA1, BRCA2. Those are the two types. Can you tell us more about that?
So BRCA1 is a gene, okay. That's, you see, there are some factors for conditions that you can change. Some factors, they are non-modifiable. You can't modify them. You can't change them.
Yeah.
For example, age. Imagine you saying that maybe you are 50, but probably in your documentation you are 40. There are some conditions that are age-specific. No matter what you do, once age catches up with you, they will definitely show up.
Of course.
You understand? So these are factors that you can't change. Also, the genetic issue, you cannot do anything about it. You can't do anything about about it. That's why science researched and said that if you do the genetic testing and we see the BRCA1, BRCA2 gene in your blood or in your system, let's do the mastectomy for you so that in the future you don't have to suffer, having to go through something that if you had curtailed now, the complication thereof would have been minimized.
But then what if you're a woman who has never had kids and you're now about to start a family and you do go through that test, the genetic testing, and they do find out that you have the BRCA1, BRCA2 in your genes? I mean, I feel like wouldn't that affect her ability to have kids? Because then when you do them, to take off your boobs, the ovaries as well, breastfeeding also comes in. How do you go about all that?
Okay, so it depends on the age you are if you haven't delivered. That's why one of the risk factors is having a child after 40. And having a child, in your adult age is one of the risk factors. So the earlier you have the case, and then if anything is being found as you go ahead, they can do it for you. There are times that breast cancer do happen in people who are pregnant. Just in the course of the pregnancy, you identify it. You let them take the pregnancy to term, then you start the treatment. But in an event whereby you think, depending, we stage cancers by doing a biopsy. So your doctor uses what we call the fine needle aspiration. So they use a needle to take a tissue from the breast area, and then they put it under microscope, study it to know whether it is cancer. You can't just look at somebody's breast and say, okay, you have the orange peel skin, you have some ulcers, you have bloody discharge, and so it's stage 3, stage 4. No. It needs to be confirmed by biopsy. So by doing that, after your confirmation, then your doctor can decide on what targeted intervention or treatment modalities that needs to be spelled out for you.
Okay, that makes sense. So that means it doesn't just mean that you have to take off your boobs and your ovaries, even if you've not had kids and all of that. Okay, but then Doc, I also breast implants and breast uplifts and all of those things, do they expose you to such, the cancer as well?
I'm happy about this question because these are all myths that needs to be demystified. That's also a second myth. People think that when you have implants, it rather exposes you. No, it doesn't. There's no research to that effect.
Right.
Yes.
Okay, so you're absolutely fine. But then when you do an implant, can you breastfeed?
Oh yes, you can.
Oh really?
You can.
No, I thought you couldn't,
You
for
can,
real.
you can.
But doesn't it sit on the tissues, like the breast tissues and everything?
No, you see the way the plastic surgeons do it.
Yeah.
It's just suits that of the natural breast. So everything functions as normal.
As normal.
Yeah.
Delphina, behave yourself.
Hi, Delphina, are you going for one? Are you
No,
going
she,
for one?
if Delphina would go for something, she has to do a breast reduction, not implants. Because if she does an implant, like, come on, she's insulting me. Look at my babies right here, like grapes. Oh wow, interesting. I've learned quite a lot. So that means Jacob, who is seated right here, you have boobs, Jacob. Yes, shake the tatas. He can also go for a breast screening and everything to get checked and all of that. So if let's say Jacob and I are married or have a family or whatever, and in my family I don't have cancers whatsoever, breast cancer whatsoever, and Jay's family does, we do have kids. So that means our kids have to get tested for that gene, the BRCA1, BRCA2, just because Jay has that in his family.
Yes. Remember, for a child to be formed, you need 23 chromosomes from mother
Yes.
and 23 from father. So definitely the genetic makeup from the father is generational, right?
Yes.
So definitely will be passed on to
Will
the
be
kids.
passed on.
Yeah.
Interesting. I see. Listen, ladies, we spent time admiring our breasts in the mirror, dressing them up and everything, supporting them, pushing them up, having to look good in every outfit and all of that. And sometimes complaining about them. I know I have complained about my boobs severally. I'm always like, it's true, I'm always like the left one is bigger than the right. And then sometimes I'm like the right is bigger. Del, don't you see? Which one? But honestly, how often do you check your breasts? I think we should all make it a part of our self-care routine, like how we have to get our nails done, hair done, and all of that. Yeah, also get the tatas checked and everything, because your life could depend on it. And early detection, it really saves lives.
And I've heard it out there that the men are saying that when you touch or when you suck a woman's breast, it's rest.
I was saying, let me calm down on this issue and come to it. I was saying, let me calm down on this issue and come to it. Because this whole month, men have been saying that to prevent... Jacob, why are you looking at me? The men have been saying that as a woman, since it's Breast Cancer Awareness Month, for them to help you prevent the cancer, you have to allow them to squeeze your boobs and suck your boobs. Dog, how does that even help? I think that's a myth.
It's a myth.
It is a myth. It's just an excuse for men to just be fondling and playing with your boobs anyhow.
But of course, I mean...
I will not leave this one thing for men. I won't. I would always know I won't.
Like a little child and the father struggling.
Right?
No, my guys, I'm fighting for you. They should leave this one thing for us.
No, we'll not leave it for you guys.
Are you medical experts to come and do this examination?
Right?
Go sit somewhere. Don't tell us what you're telling
And the craziest part is...
Like we see on the show, everything is done based on research, or everything is said based on research.
Nigga, please. No, and the fact is, you have a baby, you're trying to breastfeed the baby, and the man is like, oh, the left breast is for me, the right breast is for the baby. And they're literally fighting
seriously, maybe
for boobs.
With the breast milk.
Yes, there are men who take breast milk. I kid you not. There are men who take breast milk. I kid you not.
It's nauseating.
Yeah.
Ew.
And then I think it was No Bra Day, and I think No Bra Day is every man's favorite day. Yes, that's every man's favorite day. And they know the date so well, but when you ask them what date is your anniversary, what date, they don't know some of these, but they know No Bra Day. It's crazy. But then I think we can also do that to the men, Yeah, No Bra Day. I mean, take off your shirts and just walk around. Because men are also...
Then you can say no boxer day.
No boxer day. All right, so we're going to go on a very, very quick music break. And then when we get back, we would open up the phone lines for questions, for... any question you have, opinions or whatever on our phone lines, whether it's WhatsApp, SMS, or you call in as well on 020-2222-073. The number again is 020-2222-073. If you're just tuning in tonight, we are discussing all things breast cancer and all things about our boobies. And tonight we have with us Dr. Josephine to enlighten us more, especially from the medical aspect. And so we'll be right back. Stick and stay. Don't go nowhere. Chests, yes. Tonight we are talking about something powerful, very, very personal, and very important. And the room service is proudly brought to you by Pleasure Avenue. Pleasure Avenue is a premier adult online store based in Accra, serving customers nationwide and worldwide. We offer a carefully curated selection of high-quality products designed to inspire exploration, enhance intimacy, and elevate your pleasure. Our mission is to empower individuals and couples to embrace their sensuality with confidence, discretion, and excitement. Connect with us on our social media platforms on WhatsApp 055-274-6582, on Snapchat Pleasure Avenue 0, Instagram Pleasure Avenue 1, and TikTok Pleasure Avenue. Yes, like I was saying before, tonight we are talking about all things breast cancer, all things breasts. And as you know, it is Breast Cancer Awareness Month, if you didn't know that already. So now I want us to talk about what happens when you find out that oh shit, I've got breast cancer. What happens? Because there's a whole emotional roller coaster that people go through, that women and men who find out that they go through. So we want to know the emotional side. What happens after diagnosis? You know, the fear, the body changes, the relationships that are affected, and, you know, how our partners, friends, and family can offer real support during that time. So, Doc, from your experience in the hospital, in the medical field and everything, firsthand, what do you see that happens when someone finds out that I do have breast cancer?
Right. So I'll share one of my experience with you. A 32-year-old had breast cancer, and that's after the biopsy came out that it was cancerous. And breaking the news to her, you know, nobody wants to break the news of cancer to another human being. So if you're very empathetic, you sort of feel it a bit. But however, you still have to go ahead to break the news, because you need some sort of targeted intervention to see whether you'll be able to salvage the situation.
Yeah.
Now, so what I would say is, it's not a pleasant, you know, news to break to anybody.
Yeah.
But you have to go ahead. Now, when you hear the news of breast cancer, it is not the end of the world. No, that's not the end of the world. I know plenty survivors around me.
Yeah.
Plenty survivors. So in as much as we are talking about how scary and all that, and they are still survivors. And I know many survivors. Just because they were able to catch it early and they were able to treat it right, and so they survived it. You see, so once your doctor tells you about the diagnosis of a cancer, they stage it. Stage 1, stage 2, stage 3, stage 4. But if you are lucky and blessed to be in stage 1 and 2, then we can spell out the option of therapy for you. You can get a mastectomy done with the radiation therapy, the chemotherapy as well. And then you can come out.
But then that means stage 3 and 4.
That's why we are preaching the prevention. We don't want to get to stage 3 and 4.
Right.
And that means you have to do more of palliative. Palliative is like taking care of the person to exit. Yeah.
That's painful.
Very.
That's very painful. I had an auntie who died all of a sudden within a space of 3 weeks from pancreatic cancer, and hers was I think hers was stage 4, and it was just about management, taking care of her, and within that space of 3 weeks she couldn't even talk at a point, couldn't do anything. She just had to start doing this, doing that, and just like that, she was gone. So it's quite difficult. I think
it has a toll on families. Look,
it does.
It has so much ramification: the economic ramification, the social ramification, the spiritual ramification.
Yeah.
Because then you begin to question: is God there? If God is there, why are we praying and He's not listening?
Yeah.
Okay. So the social, the economic, the spiritual, the physical. You know, the psychological. Because then you are drained.
Yeah.
You see, imagine you have sections of chemotherapy to do, maybe 3 weekly or every month. And you probably need to go with your mother, your father, your wife, your siblings. It means that they will have to put everything they are doing on hold
aside,
just to be there for you.
Of course.
You understand?
Yeah.
So,
and it's not just about the hospital visits.
no, it's
the
not just
aftercare
the
as well.
aftercare. You know, sometimes after chemotherapy, they're having the nausea, the vomiting, and all that. And you need to be there. You need to rub your hands at their back. You need to tell them it's going to be fine. Because sometimes they lean on our faith and our hope. So if we break down as a people, as a support system around them, if we break down, that means that they are also going to break down literally. But when we are strong and we are able to whisper into their ears hope, okay, and sense of, you know, belonging and trusting God. I mean, we cannot take God out of the whole thing,
Of course.
but also let's not be over spiritualized things as well. Let's do the orthodox and do the spiritual.
Of
bit
course,
it.
they go hand in hand.
Yeah, the toll on families is crazy. I'm sure throughout this period there are some families that came out to share their experiences about these cancers and how it affected the home.
Mm-hmm.
You know, the news sort of like it numbs everybody. It's like, are we going to ever get through with this?
Mm-hmm.
You get it, but trust me, you will get through with it. Once it's picked up very early, you get through with it and you can survive. I don't know if you heard a story of Stephanie Benson.
Mm-hmm. Yeah.
Stephanie shared her story
Yeah.
of how her great grandmother had died at 45, and how her grandmother died at 45, and how her mother, and then when she was 45 or 50, I think just around that age, she was diagnosed with.
Yeah.
Lucky for her, and
It was
blessed that
early.
she is, she was able to pick it. That means that she knew her body.
Yeah.
That is where the emphasis is going now.
Mhm.
Prevention.
Yeah.
Because
I remember very well. She went through a lot.
Yeah.
And I think at a point she stopped posting for a while. Even when she came back, she had lost so much weight. She wasn't looking like herself. And then it was until when she opened up, then we all understood what she went through. It took a toll on her body, for real.
It will. That's what I
Yeah.
was talking about, the physical, the psychological, the emotional, the social, the spiritual bit of it. It's the ramifications are so many.
Yeah. And your support system has to be really strong.
It has to.
Really strong.
It has to. It has to. Other than that, you just break down.
Mhm.
Because you, the person supporting, might break down even more than the person who has that condition.
Mm, mm.
Yeah.
My people, if you are, you know someone who's going through this right now, would love to hear from you. And you can call and text us on 020-2222-073. The number again is 020-2222-073. You can send in your messages on WhatsApp and SMS, and also call in as well. What's one thing you wish people understood about breast cancer, Doc?
Yeah, so I think that the reason why we do not catch up the condition very early is because of a number. It's multifaceted. So we can be looking at things like people feel immune. They feel like, okay, no, in my family nobody ever had the condition, so I'm never ever going to have it.
Mm-hmm.
You see, so that's immunity to the condition, but it can happen to anybody, like how
Anyone.
you said. Yes, and then sometimes over reliance on faith. We think that's okay. It's purely spiritual, and so we are just going in that direction and not
Right.
looking at
Okay.
the other side. And sometimes people don't even notice it. Lack of awareness. They are not
Yeah.
aware. That is why this program is
Of
very
course.
good. It's going to sensitize and
Mm-hmm.
let them know that, okay, not only do we talk about all the things they hear on the program, but
Mhm.
also it's also educative
Educative, yes.
as well.
Mm-hmm.
Yes, so these are the reasons why people do not report the condition very early, and then we see them in our first. Sometimes, some people will just go and do other things, rub all sorts of herbs on it, and before they come,
It's too
oh
late.
my God, it's not a sight to behold. So we are pleading with the general public that get to know your body, pick up the signs and symptoms early, report to your healthcare provider.
Mhm.
You see, you can catch the disease very early, but if you don't treat it right, you will not survive it.
Of course.
So you catch it early, and somebody will say maybe there's some man somewhere go and do some,
Ah,
you know,
as
all those
usual.
things. Yeah.
Go to church, go and pray.
Yeah. We are not saying praying is bad, but
No, it's
it
not.
has to be like hand in hand.
Of course.
So you do the orthodox, and then you
Mhm.
do the spiritual bit as well.
Even in the Bible, it says it says in the Bible that God helps those who helps themselves.
Yeah.
So God has given us the signs, the knowledge, and everything to know how to go about it. So when you detect it early, you go through the right path to do what you have to do. So, Doc, at this point, I want us to talk prevention. How do we, as a people, prevent breast cancer?
Okay, thank you. So the prevention bit of it is where, as a country, we should look at, because you see, the burden of the disease is very huge.
Mm-hmm.
The burden of, even on families, the burden of the disease on families and on government is very huge. But you see, this chemotherapy, and sometimes our healthcare system, there's some sort of subsidy. Okay, so if we are able to go prevention, then we would free the economy a bit from struggling. You understand? So prevention is always key. There's a saying that it is always better to be safe than to be sorry.
Yeah.
So let's practice the prevention where we are doing the breast self-examination, like I've said, 3 days after your cycle, with the soap on the body and water, and trying to feel your breast, looking at the symmetry and all that. Then also, if you are before 40, you have to ensure that once you pick up anything in your breast like a lump, you make sure that you do the breast ultrasound. After 40 is mammogram. One thing about mammogram is able to detect the very detailed, cancers or cancerous changes that the breast self-examination will not be able to.
The mammogram is the one you put your breast and then it puts pressure.
Yes.
That shit is painful, dog. My mom did it some years ago. Yo, that shit is painful.
Dog, I want to ask a question. You see, with the preventive measures we're talking about, we having the early screening and all that to detect if there's a lump or an abnormality, so we go get the mammogram. How accessible or how cheap is the mammogram for everyone to? I mean, if you get screened and we catch this abnormality, you're asked to get a mammogram, how easy is it accessible?
Okay, so recently my Brazilian missionaries went to ask for the price of a mammogram for their church members, and I think it was around 350 Ghana cedis.
Okay.
350.
Yeah.
But then 350, I'm just imagining how many Ghanaians can afford that.
That's true.
I'm just wondering how many Ghanaians can afford that. We have a phone call. Let's just answer that right quick and then proceed. Hi, 60.
Hello, Pearl. Good evening.
Good evening, my darling. How are you?
I'm good. And how are you?
I'm good, baby.
And how are the kids and everybody, the family?
Everybody's good. Everybody's good. What's good, 60? Let's hear from you.
I'm doing great, too. Doc, good evening.
Hi, good evening.
Delphina. Yeah, Delphina, good evening. And thank you also, for coming around to educate us about, breast cancer. I haven't had a chance of, being around a person who has it. But I want to know from you that where is their state of mind when they find themselves in such situation? And if I'm around such a person, what are some of the activities or things I need to do around the person to at least, ease the person a little bit from that, that fear?
Okay. So, for every diagnosis of cancer, nobody is happy. The patients and the family members around. So, at the time when they receive that diagnosis, a lot of processing goes on. They process a lot of things and they wish they get better. Every cancer patient wishes they get better. However, it depends on the stage of the cancer. Now, I think the follow-up question was what?
60, what was the follow-up question?
What are some of the activities or some of the things you need to do around such a person to, let the person know that everything's going to be
okay. Yeah. It's not anything special. You just encourage them, speak to them, take them to church, watch movies, just, the social things that we do in our everyday homes. So movies, play music. If they like gospel, you play gospel. If they like contemporary music, you play for them. Whatever they do to make them happy, you just do. Nothing, in rigidity. You just go with the flow. But you need a psychotherapy. In an ideal setting, it is a multidisciplinary approach whereby the oncologist is involved, the physician specialist, the surgeon, the psychologist, everybody is involved. So you need the psychotherapy to be going on just to reassure them, and also the church can also play a role as well. So it's a holistic approach and not a one-sided approach.
I don't know if I can give a suggestion. I can also contribute to. I feel like when person go through that process, you have to allow the person to be themselves, right? You allow the person to be themselves, let them enjoy whatever they want to do, because the more we restrict them from the things they love to do, the faster it kills them, because they feel like, anyway, I'm dying. You see, I'm just talking from a different point of view. Your point of view is, classic, like it's something that you need to go and see a doctor and all this stuff. I'm talking from somebody who is ready to die. A person who is on that edge.
Then means that stage 3, 4 we are talking about. But stage 1,
3, 4, yeah. Yeah, that's 3, 4. You just allow the person to do what they love to do. And always, it's not, you encourage a person, but allow the person to, have their space. And also, I know when you exercise a lot, it also helps in a way, The body, I know, I don't know, I might be wrong, but I know for a fact is that the more you engage the body in activities, it has the capability of, repairing itself, repairing itself, like, the tissues. It's the body itself, You see, that's the reason why when you have a cut, and with the help of others, other how do you call it? Other healthy, medicine or natural stuff, like it heals itself. The body has the capability of healing itself. So sometimes we need to engage ourselves in such activities, and who they make out.
60, we understand you.
I hope I make sense with whatever I've said.
Of course, yes. You're trying to say that everybody should just be active, because that's another way to to keep your body moving. Okay, all right. Thank you so much for calling in, 16.
Sure. Thanks so much.
All right, no problem. Doc, as 60 was talking, something came in mind. There's this habit of, I don't know if young people of these days do that, but back in the day when our grandmothers or great-grandmothers would stick money into their boobs or their phones into their boobs, I think people still do that these days. Does that also expose you to the cancer as well?
Okay, so we talk about radiations, and radiations, as we know, these are, the x-rays that we do unnecessary are the least thing, the MRIs, the CT scans, and sometimes exposure, wherever you are, if maybe you are close to a factory. That's why countries have laws. Environmental Protection Agency has gotten laws for establishment of factories, because these factories do emit radiations that we don't know of. And so these are the radiations we are talking about, and not the radiations from the phones and the money you are talking about.
Okay.
But I think vigorous studies is still ongoing. Yes, science is not static. It keeps changing.
Yeah, it evolves.
From time to time, there are new research, new findings, and so I'm sure in time to come, we'll get to know whether these things are also the root cause of.
Okay. Okay. All right. So, Doc, in fact, we're talking about the prevention. Yes. Are there any other means and ways aside, having to test, knowing your body? I think that's what we went through. Yes. Are there any other ways to prevent, or to at least stay away from cancer?
So you see, this is a condition that you cannot stay away, but you can just be aware that this is my body, and should anything happen to me, let's say I'm feeling a lump, I'm seeing something funny, then I have to report. Just report, early report. It's not just reporting, but report timely, because you need timely intervention.
It's not that you find out today and then you wait for like 1 week.
No.
Once you find out today, you have to report today.
You have to report.
Yeah.
And then not every lump is cancerous. Not every lump, especially in your 20s and 30s. Most of the lumps you see are benign or non-cancerous lumps. We call them fibroadenomas. These are not cancerous lumps. So a number of times people see lumps in their breast and they are alarmed. They are afraid of what the outcome will be. Most often in young people, if you do the biopsy or histopathology, the histopathology at the end of the day, you find out that most of the lumps they take out from the breast is not cancerous. Yeah, but as the age advances, from 40s, that's when you are allowed.
Okay, but I think there's some category of people who are not allowed to do the breast cancer exams. I think pregnant women, breastfeeding mothers. Who else? Or is it just those two?
No, it's just pregnant women and breastfeeding. And even pregnant women, the reason why we don't do is that, you see, when you are pregnant, the estrogen progesterone thing I spoke about, and then your breast becomes very tender. So now, what are we looking for? We are looking for a lump.
Yeah.
It will be very difficult for you to be able to identify some abnormality with your breast.
Right.
You understand? And when you are breastfeeding is a factor that favors your decrease to you getting breast cancer. Because at the time when the hypothalamus has secreted the oxytocin for you to produce the breast milk, that time estrogen has gone lower. And there's a statistics that says that if you breastfeed entirely for 12 months, you reduce your risk by 20%.
I see. So when you have a baby and you decide to breastfeed, that's another way to prevent or even lower
a protective factor.
Breastfeeding. Interesting. Okay.
So this is what the men hear and they go like,
yeah, they want to suck the boobs and everything.
hell no.
Hello. Hello.
Yo, my lady.
Foreigner was good.
How you doing?
I'm good, darling. How are you?
How's everybody doing?
Everybody's good.
Yeah, Radafina, what's up?
I'm okay. How are you?
Charlie, I'm okay. I just need you.
Hey.
Oh, okay.
Foreigner, I beg, reduce your volume for the back.
Oh, I'm far away.
Okay, I was hearing a little.
Doc, hope you're doing great.
I'm fine, foreigner.
Doc.
Foreigner.
You see, the ladies, they are not calling. They want us to call and ask the question, so I will listen.
We've caught them.
You see their problem. And when we are helping them, to fight it too. They say we are sucking too much.
How are you helping? Are you saying that they should bring out the breast for you to suck?
No, see. I had, a lady broke up with me because she said I was sucking her breast too much. But she didn't know that I was examining her breast.
60. I said 60. Foreigner.
Oh, she didn't know I was examining her breast. If there's a fault, I will notice it first. Oh, baby. Oh, it's like this is your breast, Charlie. It's like something is doing it, Charlie. Like there's some things. Yeah, because I'm seeing the breast like every time. See, and Doc, please, I want to ask this question. This extra breast, how does it come about? Like the breast are not the armpit, you know?
The breast and the armpit. There's nothing like that.
No, you don't. Oh, I have this. How do you call it? This friend.
It's just when they are obese, they have, a lot of flesh and all that extend into the axilla area. It's not like they have extra breast.
So there's nothing like extra breast?
No. Yes, please.
Oh, why are you laughing? You see? We know everything about ladies, so we like monitoring spirits. We watch everywhere. You see, they are not calling. We'll call you and ask you. We'll ask them questions. They are listening. Their own body. They won't call and ask them.
Ask.
Doc is here. Just free. Call and ask to. That want to problem.
It's not easy like
that. You can ask on their behalf.
Exactly.
Doc, another question. Is it true that the breast one is like sensitive than the other?
Sensitive? No, the nerves are all equal. Yeah, the names are all equal.
But some ladies are, you see their breast, their left breast is very when you touch it.
Hey, foreigner.
Foreigner, where did you hear this one from? That their left breast is more sensitive.
No, but some of the ladies, you see their left breast when you touch, they wet very much.
Maybe we have to conduct a research into this. We will
that
know
is
what the
for looking
findings
to.
will be.
Foreigner, from the way you're talking, your favorite is the left breast.
Oh no, see, that's the part too. So I want to know which one is the sensitive. Like, yeah, so that. Well, I'm just asking this question for a friend. She can't call.
You're asking for yourself or for your friend.
Oh, she's too shy. She can't ask.
Okay.
So I'm just trying to ask on the behalf.
You. But foreigner, even though you're asking for women, you know it applies to men as well, right?
Oh, when I want to be prostate cancer out.
No, men can also ask dog. I mean, dog
by the
ask them
1%.
to be corrected.
1% in the whole generation.
Hey,
the
then
whole
he was
generation
listening.
cancer.
The way he's giving us the statistics.
Exactly.
I see.
I see.
No, pardon.
No, Doc is saying that you were listening because the way you mentioned the 1%. You
Actually, they do research too. Like a whole generation can pass and no one can get.
It doesn't.
So that one, when I want to be the prostate one, so we go for 1 hour. Every time I go to hospital, they check on my one, Charlie. I will do my check.
We hear you.
But I don't understand. You see, look, this our country. Unless something happened to you before you go to the hospital and go and check. Why are our ladies like that?
The men too. You see, the funny thing is the men have a poor health-seeking behavior compared to females. Yeah, because when I'm running hypertension and diabetes clinic, most of the people I see are females. The males, they will not come. They only come with the stroke and the heart attacks.
The women who are giving the heart attack.
I knew you.
When you're chopping vagina, you get the heart attack.
Oh. See, Doc, me, I love breast war. Breast is something which I can't do that.
Really?
Oh, yeah, that's the key. Me, Doc, this is my last question. I don't know, but anytime I have this special lady, anytime I'm looking up with her, like there's breast milk coming out from her breast, and she doesn't have a baby. She has never given birth before. Is it a cause of alarm or it's something natural?
That could be a hormonal imbalance, and so she needs to see her doctor.
Wow. I thought she only been complaining about something there. I'm just when I'm squeezing that and water is coming out.
So when you squeeze it and water, what do you do?
Drink it.
I don't do anything with people.
Sorry, now you didn't lie.
Oh, I don't do anything with it. She hasn't given birth before. So I was just you haven't given. Why is it that you have breast milk in your books?
Then what does she say?
Well, she said that it has been there for a very long time, but I don't know whether she's going for medical checkup or what.
It's not normal. You need to help her go through it, get through it.
You see, that's what I'm asking. You see, there are some ladies going through this show, but they won't talk.
It's not normal. It could be a hormonal imbalance. Or it is a hormonal imbalance, or other factors could also.
Oh, so it's not normal?
No.
Oh, they are for college.
Please do.
For college. Look, me, breast, I know the joke that breast. I love breast.
Foreigner.
I can
But me, if I come back to work, I can look at breast and I take the really straight.
God.
God no, he try power. If God no do breast, what? Because the way the country hot, the country hot, you have to release stress.
And it's from breasts.
Sometimes you see the handworking of God. Charlie, the way some of the babies, Charlie, I read them a breast for the dressing side, Charlie. You see, it's not Charlie, like your stress is down. Then I'm just dry.
Yes,
Because of that, every time I take public transport.
That's
Foreigner, bye bye. Foreigner, bye bye. Thanks
So
for calling.
I don't think you go sack me. Because,
Of course, every time I suck you.
Oh, see, the funeral get it about that. See, she's suffering though.
Who is suffering?
The funeral is suffering.
How is the funeral suffering?
See, if I make me talk as well.
How?
Oh, I'm just joking. It's just by the way.
Foreigner, bye bye.
But we do love that. So we want our ladies to go to the hospital and go for the checkups. They shouldn't wait for the cancer to pop out before they go to the hospital. So we beg them on behalf of YFM. We beg them. Then they listen. It's not only October that we'll be going to the hospital and check. Like every month or for good and check. You beg them.
Yeah.
Beg them.
Thank you for calling in.
They think it's for all of us.
Yes. Thank you
so
for calling.
Shout out to you, girl.
Yeah,
you ladies are doing a massive job. They should go. We want to hear them. No fear.
Hey, foreigner, bye bye. Bye bye. Anyway, so Doc, I want to quickly go through some myths that we hear about in relation to breast cancer. Let's just answer this call before we go through the myths. Hello.
Hi, good evening.
Good evening. Your name and where you're calling from, please.
Okay, so my name is Matthias. I'm calling from Spintex /B 17. Yeah, so I just want to say thank you so much for putting up such an insightful show and program this evening. I really appreciate Doctor for sharing her insight and everything we need to know. I mean, the basics about breast cancer and the awareness and all of that. Thank you so much, and God will bless all of you and
Amen.
team for putting up this. Yeah, so
Amen.
that's what I have to say.
Amen. And thank you too.
You're welcome.
All right.
I really appreciate it. Okay.
No problem. Bye.
Okay.
All right, so Doc, let's quickly go through some myths. So we just busted one myth, which is that what men say that they have to suck the boobs and play with the boobs is in fact a myth. Right. So another myth is that wearing an underwire bra, you know the bras that have the wires in it, yeah, those can cause breast cancer.
No.
Is that a myth or is not a myth?
It's a myth.
It's a myth.
Yeah.
Okay. All right. But that thing in general, is it even good for the breasts? The wire under the bra? It doesn't do anything. Okay. So another myth is using antiperspirants. Yes.
Yeah.
That contain aluminium can cause breast cancer.
It's not true.
Not true. Okay. Eating soy products can cause breast cancer. Yes, soy products.
Not true.
Not true. That's a myth. Okay. And breast cancer always involves a lump.
No, that's
Not
all the
true.
time. You remember when I was saying how it presents? I said
Yes.
that it can come somewhere in the armpit,
Yes.
and they might not even see that a
Mhm.
lump is in the breast. It's not always like that.
Okay. All right. And I think I know the answer to this, but I'll just read it anyway. Breast cancer only occurs in women. That's a myth. Yes. Okay. It occurs in men as well.
Yeah.
Breast cancer is usually genetic.
Not usually. There are other factors that.
There are other factors. I see. Okay. All right. So we're gonna go on a very quick break, minute or two, and when we get back, we're just gonna conclude. And if you have any questions, opinions, want to share anything, personal experiences from or someone you know, feel free to do so. To call us on 020-2222-073. The number again is 020-2222-073. We'll be right back. Stay tuned. We're talking all things breast tonight. I want us to loosen up a bit, Jess. Breasts, now breast means different things to different people. That's beauty, motherhood, sexuality, or identity. Our breasts, one way or the other, defines us in a way. And so I want us to talk about body confidence, surgery, and even how pop culture shapes our how we view the female body in regard to our breasts. I want to start with Delphina first. Delphina, how do you feel? How does your breasts help you feel confident? Yes, talk to me, because your watermelons are crazy.
I wouldn't say confidence.
Yeah.
I am.
Let it out.
Well, sometimes I'm like, oh, they look good in this outfit. Other times I'm like, nah, I don't like it. I wish they were smaller.
You wish your boobs were smaller. How
Yes.
small?
Have you seen me? No, I am small. It's just the boobs that are big. Do you get it?
How small?
So, yeah, like yours.
Excuse me?
You can wear anything and everything with this.
I cannot wear anything and
Oh.
everything.
You see, that is it. That's
I
the problem.
can't. There's some outfits that I wear and I'm like, God damn, I wish I had like some extra to like push it up.
No. So,
You wish your boobs were like
people see me and
mine.
they're like, oh, you're so confident in what you're wearing in your. I'm like, no, not entirely. No.
So do you think in the future you'd get like a breast reduction?
I wish I can.
In the future?
Yeah.
When I become a millionaire, we'll get that done.
Thank you. Whenever I have mentioned that to my mom before, and she's like, no, you don't need it. I mean,
The breast reduction?
you don't need it.
Mm-hmm.
Just be you. Live in your skin. Don't care what people say. Just
Once it's not medically affecting you in any way, I mean, just...
aside, I used to have tears in between my boobs because I don't have separated. You see how? Yeah, no, mine is joined in the middle.
together.
Yeah,
I see.
so that
Okay.
hurts sometimes.
I see. Okay. Wow, that's new. Okay, so let's answer this caller. And hello.
Yeah, hello.
Hi. Good evening. Your name and where you're calling from, please.
Hello. My name is Bless and I'm calling for Ajatomi.
Okay, let's hear from you.
Yeah, so I have a problem I think I would like to share with you.
Okay, let's hear it.
So, I think 3 or 4 years back, one of my friends, I'm a guy, one of my friends,
Okay.
I don't know if you call it breast or chest, one of my friends. So the nipple got swollen, and then it got to a certain time, there was a certain colorless fluid coming out from it.
Sorry,
So I
please
went to
repeat
the-
that again. What was coming out of the breast?
A colorless fluid
Okay.
coming out from it. So I went to the hospital, and then I ran a scan. What they told me is that there's nothing wrong with it, but it's just that my tissue is just outgrowing. So right now, the fluid is not coming, but my nipple is so bigger than the other one, bigger than the left one. And then whenever I touch it, I can feel that it's like there's something within it, which is like really tight. So I don't know whether I'm safe with that situation or not. Because I've been to the hospital.
Okay. I think this one we're gonna hand it over to Doc to answer you.
Okay.
Yes.
I didn't get the question.
Okay. Please repeat that again. I think he said that.
About 3-4 years ago.
3-4,
he had,
yeah.
A tissue growing in his breast and colorless liquid discharging from his nipples. He went to the hospital, had some scans, and they said it's just because of the outgrowing tissue. And even now, he has the nipple, which was affected, bigger than the other one. And when he touches it, if he feels some liquid in there, is he safe?
Okay, so I'll say for every growth that you feel, you need to see your doctor for them to take the growth for histopathology. More especially where you are talking about the nipple area. Your doctor will need to do a histopathology to find out why the growth there, because not so many people walk around with growth in that particular part of the body. So your healthcare provider needs to do that, just so they can be sure that whatever is going on is not anything that has a relationship with cancer. I'll tell you a story. I think 2-3 months ago, my uncle had some sort of like a bump in the in the head area.
Mm-hmm.
And this is what happened. So he had ignored it, and then it looked like a rash.
Mm-hmm.
It looked like a rash. So he had ignored it, and he just used his finger to take it off, like how a pimple is, and then he just used his finger to take it off. Then the thing kept growing, and then all of a sudden sometimes you see flies flying over once in a while and all that. So he had to go to Kolebu to go and see what was happening. So the script is of mostly every tissue, every tumor, every lump, every growth they scrape off. They have to do histopathology to find out whether it is cancer or not. In fact, when they did it, it was a cancer, but at an early stage.
Oh my goodness.
Yes. So growths in our parts of the body are not supposed to be taken lightly.
Right.
You don't just go and say that, oh, we did a scan and you haven't finalized anything.
Mm-hmm.
Did a scan. The a right setting where you have, doctors there, they will be able to escalate it further and know that, no, we need to take this tissue and do a biopsy or histopathology to ascertain what it is. Just like how fibroids are taken out and then we still go ahead to do histopathology. Would have said they are just fibroids and then we don't need to know. But because it's a tumor, every growth you take from any part of the body, you need to do histopathology to find out whether it is cancer or not.
Right. Okay. All right. I mean, we've lost the caller, but I'm sure he's still listening. So if you are still listening, in conclusion, Doc is saying that you should go to the hospital to get it checked furthermore. Yes, I hope your question is answered. Doc, I would like to ask, what do you how can women care for our breasts very well? How do we care for our breasts?
Is
very
it post-diagnosis or pre?
Post and pre.
Okay, so pre-diagnosis, you just need to know yourself very well.
Mm-hmm.
Then you'll be able to identify every little changes that happens to your breast.
Right.
Post-diagnosis, it is a process. It can be very uncomfortable, of course. You knowing that, you had your two breasts and all of a sudden, because of mastectomy, you do not have them again. It can be very uncomfortable and draining. But with time, you adjust. With the right support groups, professionals, and the right people around you, you will adjust and you do just fine.
Just fine.
Yeah.
Okay. All right. That's great. Jacob, I would also like to ask you, how does your chest makes you feel? The boobs, the little tiny things on your chest. Yeah, how do they make you feel? Do they boost your confidence?
We have no use for them.
You do have use for them. Doesn't your girlfriend play with your chest? Doesn't she play with your nipples? So I know some men, their feelings are in their nipples. Yours aren't in your nipples? They're not? So your nipples don't make you feel good?
Shit, no.
They do. Okay. All right. That's good. Don't you know why? I see. Okay. That's good to know. So yeah, I think whether it is perky, big, small, saggy, natural, or enhanced, whatever or however your boobs are. In fact, Doc said earlier in the show that if you do have breast implants, if you do want to get breast implants, it doesn't affect breastfeeding or anything in your life. It's just normal how they do it these days. So yeah, that's about it. Let me quickly read through some messages right now. 60 says, why are you it is not 60 says, it is not pearl. Those breasts need to be sucked. Okay, 60. Why are you trying to deprive us of our rights to breasts? Are you trying to
Save
turn...
your life.
Nigga, please. 60 further said, are you trying to turn Jay on? I'm not trying to turn Jay on, but I'm just saying some men have their feelings in their breasts, so they might like it sucked or whatever. I don't know. How is that weird? No, Jay, you were saying something. You said something about suck a boob today. You are a nasty guy. Do suck the boob, but come on, be gentle with it. If you have a lady who has a baby, let the baby suck the breasts. A baby. To be a rapper. If you have a lady who has a baby. God damn it. You see, my rapper name could be, what could it be? What could it be? I'll get a name and then let y'all know next week. Yes. But yes, Doc, any last words concerning everything we discussed and furthermore tonight?
Yes, my last word, my emphasis would be on the prevention, prevention, and nothing else. And also the breast self-examination, doing your ultrasound at the least lump you see, doing your mammogram every 2 years for our mothers or our sisters, our friends, our aunties, our colleagues, about 40. Yeah.
Doc, is it possible that you could just quickly describe to us how to do the self-examination at home or even in the shower, so that we can also know how to go about that? I think we did that on Saturday, but for those who couldn't come through, to have a clear idea on how to go about it.
Okay. All right. So first of all, you need to stand in front of a mirror. Then you look at the two breasts. You just visualize it. You're looking at size, shape, contour. Then after that, you have to now look out for changes in the nipples, like retraction, inverted nipples, like changes in the skin, on the skin, like maybe that one looking like an orange without holes that you see in an orange. Those orange-like peelings that we see on the breast. You are also looking out for ulcers, sores around the breast. Then after that, you feel the breast. How do you feel the breast? You go in circular motion with your fingers, 3 fingers. Okay, so you start touching them in a circular motion. Then you come into the middle, and then you can squeezing to see whether there'll be any bloody discharge. And once you touch it around, if there's any lump, you do. Not forgetting your armpit area. You touch the armpit area to feel whether there's any lump or anything. Then it can be picked up early.
Okay. All right. I hope you guys have heard what Doc had to say. I think we would also have some type of demonstration as well on our social medias, as on YFM, across all our social media platforms as well. So tonight's conversation has been deep, honest, and empowering. And thank you so much to Dr. Josephine for sharing her knowledge and reminding us about the awareness to save lives as well. And to you listening, check yourself, love yourself, and take care of your body. Remember, early detection is protection. A big thank you to our sponsor, Pleasure Avenue, for standing with us in spreading not just pleasure, but wellness and awareness. Pearl Turbo, this has been Room Service. And before we go, I just want to say a huge happy birthday to Jacob. His birthday was yesterday. Happy birthday to Jacob. We love you, Jacob. Yes. And another huge happy birthday to my best friend Hobart. Happy birthday to her as well. And until tomorrow night, well, not tomorrow night, next week, Tuesday. Yes. Stay safe, stay aware, and as always, take care of your heart and your breast. Same time next week, Tuesday from 10 p.m. to 12 midnight. We love you. Stay and take care.